Tuesday edition of our COVID webinars and problem-solving information resources. My name's Kerry Mahoney from the ARC of Massachusetts, and I'm going to be your host today. Today, we're very fortunate to have two staff from the Department of Elementary and Secondary Education to talk with us today about transition and a little bit about COVID and some of the ramifications on transition, but as well as some new guidance that just came out on turning 22. So really important information. But I want to welcome Amanda Green and Teri Valentine. And both Amanda and Teri work within special education and are really experts in the whole transition department. So anyways, without further ado, I did, want to introduce them, and we'll take it away. Amanda and Teri, if it's okay with you, we typically save questions to the end, and that way you can make sure you get through all your slides, and then folks can either unmute themselves to ask a question, or you can certainly put them in the chat box. So the other thing I just wanted to let you know is that we are recording this session, and the reason being is we'd like to be able to share this on our YouTube channel afterwards. So you have all been muted upon entry, but again, if you have a question at the end, you can unmute yourself. So at this point, I'm trying to change my slide, and I don't know why I can't. Sorry about that. All right, I think I got it now. Okay, so why don't you take it away, Amanda and Teri.
Hello, everybody. Kerry, we are so grateful to be here. Thank you very much to you and to the ARC for giving us this opportunity. As Kerry said, we are both representing the Department of Elementary and Secondary Education. Teri is the Director of the Office of Special Education Planning and Policy Development. And something just happened to my slide. Okay, sorry. And I am the statewide secondary transition coordinator. I want to begin, next slide, Kerry, please. I want to begin by acknowledging how hard these times are. Parents are making enormous sacrifices and contributions to their children's education, and the department really acknowledges and honors everything that parents are doing in the same way we acknowledge and honor everything that educators and service providers are doing. None of this is easy. No one has ever done this before, and we're all trying to figure it out together. So thank you very much for everything you and all of your partners are doing to serve our students with disabilities. So to begin with a reminder of something basic. As you know, under the Individuals with Disabilities Education Act, otherwise called IDEA, all students with IEPs are guaranteed a free and appropriate public education. So under COVID, of course, FAPE is going to look different than it would normally. For example, as you know, to protect the health and safety of educators and students, your child, if you're a parent, may be actually in a classroom, but perhaps there are fewer students in that classroom than there normally would be. Or maybe your child is receiving FAPE over the phone or on the computer. It's just going to look different under COVID. Next slide, please. So since this is a transition talk, I obviously want to focus on transition. And part of a free and appropriate public education for students with IEPs, if they're age 14 and over, is secondary transition. And so what is secondary transition? It's a coordinated set of activities for a student with a disability that's designed to be results oriented. So we're looking for, successful adult lives as much as possible. And that's what we're working for. And all the partners are coordinating all of the activities that happen inside and outside of school for these students so that the student can improve academic and functionally and be able to achieve adult success. Next slide, Kerry. In Massachusetts, we have a visual model which expresses the framework the way our beliefs, our values, the way we think about transition in Massachusetts. We've had this around since 2013. It was developed by a large group of stakeholders along with the department, and I hope you've seen it before. So, and in fact, you can look at our website to find a written description of this model if you'd like to learn more. What you see, the dark blue line is supposed to be an infinity symbol, and I'll talk about that in a second. On the left-hand side is the student in school. The right-hand side is the student in adult life. And if you look at that student is self-determined. So that student is in charge of their own lives. The student understands their strengths, understands their weaknesses, knows how to seek appropriate help, make choices and decisions, everything that's involved in self-determination. And in the student's outstretched hand is the student's vision for adult life. And the student's vision for adult life guides all the secondary transition work. What does the student want to be and do as an adult? And over on the right-hand side, you can see the star in the model has become big because that's the student's success in their post-secondary life in the 4 transition domains of post-secondary education and training, competitive employment, independent living, and community participation. While the student's in school, the student experiences opportunities, that's that arrow, to help the student achieve adult success as much as possible. Over on the left-hand side, again, the student in school is supported by the whole school, by transition assessment, by the transition planning form and the IEP, all of which may be familiar to you. And then that outside infinity symbol is there because students are supported throughout their lives, both when they're young and when they grow up, as we all are, by a network of support. All of us are both to some extent independent and to some extent interdependent. We rely on others. So students may rely on their family, on their community, and on adult services to a greater or lesser extent throughout their lives. And that's what that's supposed to indicate. Next slide, please. So, in the age of COVID, educators and related service providers and families are all learning together, are all learning too. Nobody's ever done this before. And as you know, we have 3 models for education during these times: in person, in the classroom, right? Hybrid, which is a combination of remote and in person, and then solely remote. And under these circumstances, the community opportunities, which are often part of transition planning, are necessarily going to be limited in many cases because of health and safety concerns about our students and for other folks, the folks that work with them and support them. And it's going to vary by district. If you're a parent and you're talking with your district, you're going to find different, you know, and then you talk to someone else in another district, it may look different because it's all going to depend on that local community conversation. It's going to depend on the local departments of health and what the decisions are being made in that place, in that circumstance, and for that individual student. So I just want to put that on your radar. You probably are aware of that already, that community opportunities are going to look different, and that's just the way it is under the pandemic. You know, if you have the capacity, it would be really helpful if you reach out to your partner educators, your child's educators and related service providers to ask how you can help. Offer insights into your child, certainly, because you've been with your child full time for a very long time, and you know that child best under normal circumstances, but also you certainly have insights to offer now. And then to share community and online resources that educators may not be aware of. There may be something in your locality or through your networks that you know about that your educators who work with your child may not know. So if you have the capacity to reach out, that would be awesome. Next slide, Kerry. Everyone's been home for a really long time. And so I suspect that a lot of people have been doing secondary transition at home for a long time. And in fact, Kerry was telling me that she was hearing from someone that that parent's child is doing chores for the first time in their life. So, you know, there is some silver lining in this whole situation. But I wanted to highlight 2 things that could be happening at home that you could be doing in partnership if you're a parent, doing in partnership with educators. Those are planning for the future and building skills. Next slide, please. So one extremely powerful tool that was developed at the University of Missouri and keeps getting better and better, I urge you to go to their website, there are links on this slide, is called Charting a Life course. It's a really powerful person-centered planning tool. It's been embraced by several of our agencies here in Massachusetts. And a great way to get a grounding in the basics of Charting a Life course is to take a look at that link at the bottom. Dr. Laurel Peltier gave a presentation on Charting a Life course, and she does a nice overview about how to use these powerful tools in transition. And there are also other links there that you can click around on and see what you find. It's, this time is really, it's always important to be helping your child plan for the future. This time could be a really powerful time to do that. You could be having informal conversations, of course, with your child.
Kerry.
Over dinner and over in other circumstances that just naturally arise in the course of life at home, and in partnership with your educators to talk to them about how these organic opportunities can come about. So anyway, I urge you to take a look at that. Next slide, please, Kerry. Another thing that students could be doing during this time is exploring future careers. It's really important for students to learn about all the possibilities out there. And these are just some resources, some links. There are lots and lots. You can explore them. Talk about these with your educator partners, and they will also have other resources as well. But an important part of transitioning for students is to assess their own interests. What are they interested in? And to learn about possible careers, things to do as an adult. The bottom link there refers to the MyCap. That's My Career and Academic Plan. There's a website from our department. Basically, our department urges that all students engage in college and career planning, and there are many platforms to do that with. I've just listed 3 of them here, put the icons. Just to highlight one of them on the far left, which is free, is MassSys, the Career Information System. Any person in Massachusetts can have their own MassSys account. So whoever you are, you can plan your future too using this. It's very powerful to use with students as well. Next slide, please, Kerry. Self-determination and independent living skills can be worked on at home. I mentioned them in the beginning as part of the visual model. This is probably the thing that I'm most passionate about when it comes to secondary transition, because research is so clear that students who know themselves and understand their strengths and their weaknesses, including their disability-related weaknesses, and can advocate for themselves to get the supports they need, we know that those students will be more successful than students who don't have those skills. When they're in college, those are the students who are going to be going to the Disability Support Office. They're going to be talking with their professors, and they're going to get what they need to succeed. When they're in the workplace, they're going to be able to advocate for themselves, to get any assistive technology that they might need, to get workplace adaptations or accommodations. They're going to know themselves and what they're good at and be able to articulate that in some way, however they communicate. And then they're going to be able to ask for the help that they need. This is so, so important. And this is something that can be worked on at home and at school, and hopefully is year-round. Skills that can be worked on at home, obviously, there's so many things. Take a look at this list. This is not all-inclusive. I'm sure you can think of many things yourselves. And this goes to the point the story that Kerry was telling me about, the parent who was sharing that for the first time in their lives, they're doing chores. Doing chores is great. How about planning to do chores? How about choosing which ones to do when? How about, developing all kinds of wonderful self-advocacy, goal-setting, problem-solving sorts of skills? This is a great opportunity if you look at it that way. Next slide, please. Other resources for you, and these are just too numerous for me to even begin to go into in any detail, but there's a National Technical Assistance Center for Transition that has fabulous stuff on their website. And also our very own Institute for Community Inclusion at UMass Boston has put some great stuff up there, particularly if you're interested in supporting your child, and if students are also interested themselves and educators are interested in competitive employment and employment in general and what that means and how to make decisions around work and whether to work and how to work and under what circumstances. Really terrific stuff on that website, so take a look. Next slide, please. Another resource that we've been developing for several years, the department has been working with the Federation for Children with Special Needs to create brochures for families, for students, and for their parents. And you can see them there at that link, all of them. There are a lot of them now. I can't remember exactly, 9 or 12, something like that. The most recent one we have is on the 688 referral. And I mentioned this, it may not be familiar to you, or it may. The Chapter 688 referral is a legal process, or it's a process that's mandated by state law, let me put it that way, not a legal process. And it requires that if a team believes that a student has disabilities that are so severe, so that the student won't be able to work 20 or more hours a week, then the team needs to submit 2 years before the student leaves school, needs to submit what's called a 688 referral. And the referral sets in process a planning process, and it also alerts the legislature that the state agencies that serve adults will need more funds. So this is something the school does. They submit it electronically online. It's important to know about, it's important to do. Next slide, please, Kerry. So as I said, schools will submit electronically this referral to the best fit agency, the agency that the team feels is the one that is most appropriate for the student, along with the student's most recent IEP and 3-year evaluation. During the COVID-19 crisis, parent consent can be obtained through an actual signature, through email consent, or through verbal consent. We've made these modifications to make the referrals easier. I want to be very clear that a 688 referral is not an application for adult agency eligibility. So if you're a parent and you want your child to receive services, you think your child should receive services from the Department of Developmental Services, for example, you need to submit a separate application for adult eligibility. 688 referral is not sufficient. It's not going to do it for you completely. It's important to do, but families also need to apply for adult eligibility if that's the route that, you know, is going to be taken for that student. Next slide, please, Kerry. Recently, very recently, the department put out a new technical assistance advisory called COVID-19 Compensatory Services and Recovery Support for Students with IEPs. You can read the whole 18-page, I think, document right there on our website at that link. The advisory has an appendix, Appendix B, that is applicable to students who turned 22 or will turn 22 between March 17th, which is when in-person school was suspended by governor's order, until December 23rd. I want to emphasize really strongly that we're living in unprecedented times, and this advisory is not precedent setting. It only applies to this time of emergency that we find ourselves in, these strange and these very weird times. Next slide, please. So in Appendix B of that advisory, you will see that the advisory suggests that you may want to convene an IEP meeting if the child was unable to access services during the unexpected suspension of in-person education, if the student has regressed or failed to make effective progress when learning was remote, if the student has significant difficulty with transitions and changes in routine, and there's concern that, you know, when the student is moving to whatever the adult setting is, that's going to be a big problem because the student wasn't supported with changes in routine. Number 4 is if no connections have been made to an adult serving agency, or if minimal connections have been made, like not much, not enough has been done. That's another reason you may want to meet. And you and your child have been unable to follow through on the transition services that the student needs because of COVID-19, or the adult agency hasn't been able to follow through. We've heard from lots of folks that you know, because day programs, for example, have been closed, parents have not been able to view them. So we're trying to address some of the situations that we've been hearing about. And 6, if your child had been expected to fill the requirements for the competency determination, that's the MCAS, fancy word for the MCAS, by their 22nd birthday, but then wasn't able to do so because the in-person education was suspended. So this is when you may want to consider to have the circumstances under which you may wish to have an IEP meeting, even though the student is already 22 or is turning 22 between March 17th and December 23rd. Next slide, please. So what are COVID compensatory services, AKA CCS? It's what is written here. Support that's individualized for students with IEPs to help the student regain skills and knowledge they lost because of the pandemic. In addition, if the student failed to make effective progress, the services will specifically address the effects of delayed, interrupted, suspended, or inaccessible IEP services. If the student is involved because and needs to be connected to an adult agency, it's really important for school and agency staff to collaborate. And it's also really important for CCS to keep the student's secondary transition needs, the needs for adult life in mind. Next slide, please. I also want to mention that parents can choose to meet informally with the school partners rather than convening an IEP meeting. The department's not endorsing informal meetings as an alternative to IEP meetings. We're just acknowledging that we're living in extraordinary and exceptional times. If you feel that your child has already successfully transitioned to adult life and doesn't need any more school services, there's no need to meet with a school. Next slide, please. So that's the end of our presentation. We'd like to open it up to questions, and we'll try to have some answers. Otherwise, we'll try to find them for you.
Great. Thanks so much, Amanda. Just feel free to unmute yourselves if you'd like to answer a question. Also, you can just chat it in if you prefer that way.
I'm going to rely on you to moderate, Kerry. So.
No problem. Yep. Just curious if anybody has a transition age student who'll be turning 22 during those times that Amanda was talking about.
I do.
Do you just want to?
I'll pop in. I have my daughter's. Oh, am I unmuted? I don't know if I'm unmuted.
You are. Yeah, you're all set. Go ahead.
My name's Erica Supple. I have a daughter who's turning 22 in December 12th. And I jumped on this call because it's been very difficult. We were in pretty good shape in the spring. We were at a point where we were looking at programs, and we were putting things in place, and people were coming in to observe her, and it all stopped. And a lot of the transition activities that she was doing going out in the community and at school were all cut off as well. And I feel like the skills that she was learning, independence, and some of those things that she's sort of gone backwards because she was spending a lot of time doing all these things for herself, and now she's back depending on us. And she just started back school today in person for the first time for a full day since March. So, and doesn't have much more time. So that's where we're at. She also
thanks for sharing.
Yeah, my daughter goes to the Cotting School in Lexington.
Okay, Amanda or Teri, just wondering if you have any recommendations?
Yeah.
I would say, and Teri, I'll let you speak for yourself. I would say that communicating with your school partners is going to be the way to go. You know, to have these important conversations about where you perceive your daughter is now, just what you've been saying here, where you perceive your daughter is and what you perceive your daughter needs, and then have a good conversation about that with your school partners. Yeah.
So in this case, it would be the schools that we're from, the Needham schools and the Conning school team.
Exactly.
So, yeah. So it's everything really being done on like an individual basis, obviously, for the needs of each child.
Yeah, mm-hmm. That's the I in IEP, right? The I in
exactly.
IDEA.
I mean, she's enjoyed it. I'll have to say that she's enjoyed the time that she's had and the different experience that she's had. But as far as looking at her IEP and going forward, I've definitely seen things that have. And the big piece that you just mentioned at the end is not having that place to transition into,
right?
And the comfort and the fact that even if there is something, everyone's wearing masks and it's just it's a difficult thing anyway, and then to have it compounded, it's
right.
Yeah.
I also know of a classmate of hers who had a very difficult transition because her birthday was March 29th. And she really, has had a lot of problems because of it too. So that's the other side of the beginning of the time period that you're mentioning.
So hopefully the guidance and will provide enough flexibility that will be helpful.
Yeah.
Good. So thank you for sharing. How about anyone else? Anybody else have questions? I have a question actually for you. I'm just wondering, can people receive compensatory services after they turn 22?
COVID compensatory services. Yes, the strange, weird, special circumstances that we're now in, that's what this guidance addresses. That is not normally the case, right? Let's not think of this as regular compensatory services, which might happen after dispute resolution and all that. That's a rare avenue, but that's not what this is about. This is just the special circumstances under COVID.
Yeah, and it's not to say that a student, this isn't changing the eligibility requirements under IDEA or under state law. So it's not saying that a student continues to be eligible. It's the context of, because of this crisis and because of these really unique circumstances, there's something else that these students need because of the interruption during this period of time. We want to make sure that they get what it was we thought they'd be getting, but for all of these strange circumstances and changes in the way that we've had to provide services to students. So it's a really narrow carving out and a really narrow exception to acknowledge that these are emergency circumstances, and so we have to behave a little bit differently now than we have to behave or can behave during other circumstances.
Right.
Yep. Well, that definitely makes sense. Yeah. How about other questions?
Yeah, this is Linda Serpernat. I'm kind of curious about this whole issue of regression and how that's going to be evaluated. Taking the parent's word for it, if you're not seeing the specialist or the people that set the IEP goals, what recommendations do you have for parents to demonstrate and or have the student evaluated to really show that there was regression and loss?
Terry, you want to go for that?
Sure. I think we can tag team this because we've all been thinking about this in a lot of different ways. One of the things that we discuss in our advisory is that we have a pretty lengthy list of the kind of information that is important to include in this context in terms of making these kinds of decisions. And so one of the really key factors, so we're not necessarily, schools are not necessarily going to have the kind of summative assessment information that they would necessarily have in the context of if kids were still in school and were still receiving face-to-face services and those experiences. So as Amanda was talking about in her presentation, one of the really key factors of sharing information is that information from families about how a student has been at home and in different settings during this period of time in which there has not been, for most kids, there has not been a lot of in-person instruction and activity. And so it's a different kind of information to collect. It's not data in terms of where we think about sort of hard data and numbers and scores, but it really is having this kind of robust conversation about what does it look like for a student right now? What has it looked like during this period of time? Have they been able to get any kind of supports? Have they shown, the inability to, have students had trouble across multiple and different domains and ways that they had never exhibited before? Even as Ms. Supple was saying in terms of her own daughter and things looking very differently now, things were on a trajectory, and how has that come off of that particular trajectory? So it's a combination of different kinds of, and everything from anecdotal information to other kinds of data and information about students' performance and ability to access and demonstrate. And so it is, I don't have a particular metric to describe here, but we're really looking at the same, similar to what we've assessed in other circumstances. What would we have expected for a student during this period of time, and how far off course are they in terms of what kinds of skills that they can demonstrate right now, or what kinds of barriers and challenges that they've been experiencing. So I feel badly, I don't have a particular metric to give you, Linda, about that, but this is why we're in this sort of different kinds of conversations and different kinds of sharing of resources and information. And I think Amanda has actually had some of these conversations with families and districts specifically about how this is shaping up right now.
So we're looking at the family and also the educators, because they've been reaching out to the families, they've been doing remote learning and observing and gathering of data. But I mean, when it comes down to the real question of, the parent says there's regression, the school says, I'm not so sure. I mean, is there any expectation of the school district, the educators, of doing some sort of evaluation upon the return to school to see, in fact, where a child is in as far as their IEP goals? You know, so if they're doing in person, I mean, this is the beginning of the school year. That's something that's always looked at, is was there regression or loss of skills over the summer? So just trying to think about what strategies families can use to not only demonstrate their concern for regression, also hopefully progression, improvement in skills for the child, but what can we look at to the school to be doing it in that respect?
Amanda, do you have any thoughts about how you've been?
I think that's part of a great conversation. So, you know, that you were just posing that question, Linda. And by the way, hello, Linda. Linda and I know each other from way back. I would feel free, if I were a parent, to talk with the school about that and ask those questions. Like, okay, so how will you be assessing my child's progress? You know, how will you be gathering data? What kind of data is it? I have data to share. Let's talk about the data. You know, I would just ask those questions as part of an individualized conversation. It's going to look different for every student, but I would definitely ask those questions if I were a parent.
All righty, thank you. How about anybody else? Anybody else have a quick question, or just about at 11:30, and I want to be respectful of everybody's time. Well, we could probably take one more quickie. Anybody has one? I do want to thank Amanda and also Teri for joining us today and sharing all that good information about what kind of opportunities are here during this time, but also, you know, the barriers that have come forth, and, you know, just the compensatory services turning 22, and also how important it is to keep in touch with your team and having these discussions. So, all righty. So I don't see any questions. So again, I want to thank everybody.
Kerry, I have one real quick one. I see Margaret's on the call. I'm just curious that if the team determines that a student requires or is eligible for compensatory services, what would that mean if the student's turning 22? Would they stay in with the school system, or would they transition to the appropriate adult program agency such as DESE or whatever? I mean, would there be that collaborative time where maybe both are happening?
Margaret, I know that Linda addressed you. I'm just going to jump in just quickly. Margaret, feel free to add. But Linda, if you go to the advisory itself, it actually contemplates either of those scenarios that you just mentioned, what the agency providing services, for example, in a school setting or a school context, or the school providing services in an agency context. It's really supposed to be an open conversation about what makes sense for this student right now.
Yeah, I haven't had a chance to read it yet, so thank you. I will definitely do that when we get off.
Carrie, I have a question or comment.
Sure.
Bonnie Thompson. Hi.
Hi,
so
go ahead.
I guess I have a concern about the students who are going to fall through the gaps. And I mean, I think I have not read the advisory, so I appreciate that there's that amount of information that I don't have. But for some of the students who really rely on community exploration, maybe these are the students might be referred through MRC, maybe, so they're not staying until 22. But this period of time where, you know, the IEP was really geared towards goals looking at their experiences outside of school, travel training and other career, you know, community exploration, volunteering, whatever. So I just have concerns about those students in how we're going to track and monitor some of the students through this period of time and in their outcomes. I don't know if that's a question.
Bonnie,
or
that's
just...
a fantastic comment. I think everyone shares that concern. Educators I speak with are very concerned about that. I'm very concerned about that. MRC, the Massachusetts Rehabilitation Commission, is quite concerned about that. You know that they provide pre-ets.
Right.
And Kerry, you might want to have, you know, them as a presenter if you haven't yet, because they're really being thoughtful about providing pre-ets and collaborating with schools. Just a suggestion. But yes, that's a concern. It's part of the conversation. It's a reality. We're all just trying to figure it out, Bonnie. Yes.
Yeah. Okay. Well, thank you. I'm glad that eyes are on
I agree.
it. Okay. Thank you.
All right.
Yeah.
Great. I'm just going to follow up with Margaret. Did you have anything you wanted to add to Amanda's comment?
I don't know if I have a lot more detail to add. I mean, we've had conversations obviously between DDS and DESE, and you know, the collaboration between you know, our local area office staff, transition service coordinators, and the family and the team is really critical. I think, you know, from what I'm hearing a lot from families is sort of, I think what Erica Supple described well, that sort of planning was underway and then everything had to halt. And so there really haven't been opportunities to kind of either finalize plans and or providers to have full capacity to really begin to deliver services, you know, fully to individuals who might be eligible for or, you know, ready to resume those services, you know, to start those services. And I think, as Amanda mentioned, so much of our services are really about access to the community, whether those are job opportunities or other experiences in the community. So I think that, you know, to the extent where it makes sense for students to be able to continue with some of the services they were receiving while in school for a period of time, you know, through the fall, to really solidify those plans that can, I think, really make a huge difference. But there are ways, if they are already, you know, eligible for, you know, DDS services, where family support services or other things can be offered in combination. I don't think it has to be a solid line, but that, you know, in many situations, a lot of that planning really wasn't solidified enough yet. So this really provides, I think, a great opportunity potentially for some of those services to be offered and some of that planning to really be better established to facilitate a smoother transition.
Okay, thank you. All right. So we ran over a little bit, but this was such important information. I love the idea, Amanda. Thank you for getting pre-ets provider on one of these sessions. Hi, Jarrett. Do you have a question you wanted to ask?
Yes, we also we're having mocks during school.
Can you say that again? I didn't get that.
No. Everybody is very mocks during school days.
Okay. Yeah. Are you going to be in school?
Yes.
Good. When do you start?
Thursday and Fridays.
Thursday and Friday. Awesome. Sounds like you got a hybrid model going on. So we're run over time, so I'm going to end the session. So thank you all for joining us, and again, thank you to our presenters, Amanda and Teri.
Also send me the slideshow.
Yeah, Everybody's going to get a slideshow. So anyways, okay, everybody have a great day, and thanks for joining us. Take care.
Thank you.
Bye-bye.
Thanks,
Thank
everybody.
you.
Have a great day.
Amanda.
Thank you.